If I can take us into a little bit more specific into value-based care initiatives as a primary example. A lot of providers are trying to figure out exactly what does value-based care look like within their health system. How can payers and providers each use explainable AI to support those value-based care initiatives specifically?
I'll take a stab at that. So, explainable AI is maybe understandable AI. So, thinking about like Matt and I've been both saying, what do I do about it? You know, I think in college I had a professor who told me ask why at least 5 to 7 times. Eventually, you'll run out of answers and get to the word because you can't explain it. So, really trying to create that pattern understanding of what's there. So the AI will raise opportunities, outliers, forecasts, magnitudes, directions, but you need to know why that's happening. And as a provider or a payer in value based care, what am I trying to do? I'm trying to create affordable, high quality care with great patient satisfaction. Um, and if I added the rest of quintuple aim, I'm helping the physician be able to have a very satisfying practice and do that with the idea of good health equity. But just the first three, which is the original triple aim, you know, as a provider in a value-based contract and a payer supporting that, I want to make sure that what I'm doing for my patients is the very best I can at the best cost. And an example might be, and we have models now that are working in our own organization that we've actually got pat pending on, which is exciting. But thinking about the fact that we've got ways to look at the provider interaction with the patient, and we've tried to remove all those things that the physician has no control over, and be able to actually measure for providers, how do my closing gaps in care? What's my prevention? What's my pharmaceutical utilization models, ED, inpatient versus outpatient? How do I look at those things and provide that high quality? You think about a diabetic who's not getting screened, simple preventative medicine, but now they're inpatient care, really sick and expensive. How could have I gotten behind that? So with the models we've got, we can explain and raise up those patients that are not meeting those needs and creating those I use the word report in air quotes because we really want to be careful. We want the analytics, the actual analytics that we can provide that tells our physicians where to go and how to make those changes. You look at a value-based contract, we're looking at things in our own organization with our own contracting capabilities. Where is that high quality network? Who are the providers network that are doing the best work? Because we want everybody to be practicing at best practice, top of license, all those terms. And we can't do that if we don't know. So really trying to find, those best in class capabilities and get everybody to move to that same level. But again, you got to measure that over time. So we want to watch that. So we've got our models doing the predictions and looking at the capabilities and also monitoring where people are. This is a journey. This is not a one-time fix. And hold accountability. We want to have those models in our value-based care really connecting to what essence what we really want is total care for our patients. What's best for them, and what's best for them actually drives the best for our providers and for our payers.